Please welcome Christian Schmidt, Foundation for Technology, Innovation and Research, Thuringia.
Good morning, my name is Christian and I work as a startup coach for the only accelerator program in Thuringia, the TRIP. There I met DeepEn, who applied for the program. The idea of developing the world's thinnest endoscopes for observations within hard-to-access body regions like the brain is disruptive and could lead to better medicable or avoidable diseases and also better conditions for doctors, researchers, or even patients. The team is open-minded, was able to think outside of the box and inside the brain, and they succeed at this year's Hannover Fair, where they won a pitch competition out of 56 innovative startups all over Germany. So I think that fact proves that they are on track, and I wish them today best of luck to compete here on stage and of course to develop a great and much needed product for the future. Thank you.
Breaking the wall to the deep brain with microendoscopes. Sergey Turtaev, DeepEn.
General notion tells us that in order to get the high magnification images, we have to go for a big lens. This is true for photography, but also for microscopy, which relies on the bulky microscope lenses. But here is a single optical fiber. This is a hair-thin glass structure, which is a part of the technology that brings fast internet to our houses. But this technology doesn't follow this limitation. In fact, the fiber resolution is only dependent on the type of glass it is made of, not on the size. And it sounds great, but there is a catch. One of them is that this fiber is not an imaging element. It's not a lens. So light traveling through it scrambles immediately into the chaotic patterns. And we at DeepEn know how to utilize digital displays, holographic displays, in order to control the light, to unscramble and reconstruct the images, turning this fiber into the world's thinnest endoscope, which can combine resolution comparable to the microscopy objectives, at the same time having a size at least 10 times smaller than the commercially available endoscope solution. And this combination of a minuscule footprint and the high imaging resolution makes this technology really stand out against the state-of-the-art techniques. It already empowers neuroscientists, and we believe in the long term can help medical doctors to bring high-resolution diagnosis into the most deepest and the most sensitive regions of the body, while only causing a minimal damage. So I already mentioned neuroscience, and it's the first field where we can make a difference, and it's also the field which is on the forefront in addressing one of the societal needs and challenges, neurodegenerative diseases. It's a great burden for our society, especially due to the aging population. Every seventh faces one of them for all life. Their economic costs are higher than one for cancer and diabetes. And unfortunately, neurotherapeutics is one of the least successful drugs when it comes to the approval to the market. And one of the reasons is that there are simply gaps in basic understanding of the brain mechanisms behind these diseases at the cellular and subcellular level. And also hard to study in the deeper brain regions due to the current imaging techniques are not able to reach it very well. We believe that here DeepEn can make a big difference. We're already running the pilot studies across 4 neuroscience centers across Europe and visualizing cells which have never been seen before at subcellular resolution in the deep regions of the living brains of animal models. So our first system for research market looks rather simple. Pretty much like a microscope, the only difference that instead of the microscope objective, it utilizes the hair-thin endoscopic probe. Our business model is rather simple as well. So it's producing and selling devices together with one single-use consumable probes, and also providing the training services. We've already built the network of about 150 potential customers and planning to launch the product in Europe next year. So our team brings together the expertise of the world-leading researcher on this topic, engineer, business person, medical doctor, and supported by the strong advisory team with both experience in industry, but also in neuroscience. We are very confident they can establish the first operation, a sustainable operation, in our first market, neuroscience in Europe. And from there, organically grow towards different geographies, but also different research applications outside of the brain. And for that, we are now securing the 1.5 million fund, our first. On the long-term vision for medical endoscopy, Right now, we're in discussions with the clinicians and the market leaders, and we already identified a couple of use cases, but also spotted a couple of, let's say, limitations of current technology. You've probably noticed that we are working with the fluorescently labeled samples, and also the probes that I showed are rather short and rigid. So these are not that compatible with the clinical settings. And good news is that both label-free imaging techniques, as well as the flexible operation modes, are already demonstrated in the lab of our co-founder, Professor Tomasz Czyżmar. They are not just practical yet. In order to push this, we are actually joining the forces with our research collaborators right now and seeking for the funds like AIC transitions. And once addressed, once having these advancements in hand, we are planning to build our next investment round in a few years from now. Thank you very much. I think I was a bit too fast.
Yes, you are 30 seconds in advance.
More questions.
More questions. Like, we have the rule with everybody. So, first of all, Stefan. Actually, we're going to start with Stefan this time because he has been waiting earlier. Please.
Exactly. So thank you very much. Very exciting. I mean, you are at technical readiness level 6, 7, yeah?
Exactly.
What could go wrong to 9? From your perspective, what are the risks? And maybe you dive a little bit more also on the resolution side of your business, given the risks going forward, also from the point of view of competition.
All right. So, what can go wrong? That's a very good question. I would say the main limitation, main barrier for us right now, in order to actually make this technology available, at least in the realm of neuroscience and later in life sciences, is the barrier of newness. That's what is the biggest risk, that it can take longer, and because it's a very new technology, it takes time to basically explain the benefits, and it also takes time. You saw that it's a rather expensive instrument, like it happens for microscopy techniques. I would say communicating, finding the maybe key opinion leaders, and communicating and spreading the word in the community that there is this new technology that can give new opportunities would be our main challenge. From the technical perspective, I would say we are rather confident. We are running routinely the imaging in the deep brain regions. We need time in order to really reach 9, and our step-by-step approach, starting in the European market, then spreading further, approaching the applications one-to-one, is, I think, rather a safe one. On top of that, we are staying in close connection with our pilot users and also our research institution. Altogether, combining this expertise, I think we will be able to make it.
Thank you. I think the second question comes from this corner. Yes, please.
Sergey, thank you very much. Great presentation. As I noticed, you have already a couple of the patent applications going on in that direction.
100%.
What I'm interested in is what is your patent strategy for this kind of technology from your perspective, and how much trade secrets do you have?
All right. So, I think it's 3 main pillars. First of all, it's the know-how, actually. That's one which we took with us, and that was created over the last 10 years of the research. That certainly helps, and it also, I would say, helps us to stand out among the competition. Second thing is the 2 patents, as you mentioned. They're right now tackling different parts of the first product, let's say. And I think the main important, and also very important factor is the third one, which is actually working closely still with the researchers. And that helps us to actually, maybe in certain case, divert the research to the right directions, but also to get the results. And that's, I think, very crucial. So first of all, because that will help us to stay in the forefront in this race. At the same point, we already have very good connection with our research institution. We actually also have an agreement on the access to the future IP. I think with existing patents and this growing portfolio, thanks to the close connection to the research, we will be able to be strong in the competition.
We have 40 seconds for a short question and a short answer. Yes, Frank, please.
I understand that you are ready to market for research purpose, but for the clinical purpose, this takes much more effort. So how much of the device is already approved as medical device for the clinical use?
Short answer, please.
Okay, so this is, none of the devices are still approved. There are still a number of technical hurdles which we are currently approaching. This is purely still a research topic, R&D, I would say, topic. It will take at least a couple of years, maybe 3 to 4 years, to address the technical limitations and then basically move forward to the clinical applications. Thank you.
Thank you very much. I even gave you a couple of seconds.
Oh, thank you so much.
Just
That's very kind of you.
Thank you very much.
Thank you so much.